Hi guys, welcome back to my channel. I'm here at Island Skin Solutions with Shauna Brenfleck, nurse practitioner and owner
Yes.
of Island Skin Solutions. And we're gonna respond today to a lot of the questions that I posted on my Instagram page. We posted the question box and we're just gonna respond to some of your questions that you guys asked. So, do you wanna say anything before we start, Shauna?
Like Hannah said, I'm the owner of Island Skin Solutions. We've been open for about 2.5 years now, but we're just kind of starting to expand our hours, expand our business. So happy that you guys are here with us.
Yay! Okay, so we'll get right into it. The people want to know what happens when Botox dissolves or wears off. Does it affect the skin or muscle?
So yeah, that's a great question. So Botox wears off for most people around 3 to 4 months, and once it wears off, it wears off. The muscle itself will go back to the way it was, maybe not right away, but over time. And the skin, interestingly, is affected in a positive way by Botox, but once it wears off, those effects wear off as well. So overall, there's no long-term damage or consequences to getting Botox and then stopping it.
Great, but what do you mean exactly when there's a positive effect? Like what are the effects?
So for the skin, wherever you inject Botox, that skin, it will help actually with acne, oil production. It will decrease the oil production, and it'll leave the skin smoother and kind of more shiny or glowy.
Yeah, I kind of seen that from like your before and after pictures.
Mm-hmm.
Like your clients look really glowing after.
Yes.
So that's like a side effect from the Botox.
Correct. Yep.
Cool. I just got some, so hopefully that happens to me. Okay, so next question is, what's the best way to get rid of dark or red spots from acne?
So those little pink or red spots after an acne lesion, that's called post-inflammatory hyperpigmentation. So we treat it similarly to other forms of hyperpigmentation like sun damage, sunspots. And so the treatments that we have in clinic, one of our peels, especially the BioRe-Peel, microneedling can help. And then we have a variety of products or prescriptions that can help, including tretinoin, retinols or retinoids, as well as vitamin C. And as always, the most important thing is sunscreen, because if you're covering those scars so that the sun can't hit them, they're going to heal a lot better and hopefully not last long term.
How often would you need to touch up lip filler? And then just basically like the maintenance of lip fillers in general?
So once you get lip filler in the lips lasts not as long as other types of fillers like cheek fillers or jawline filler, because you're constantly moving your lips, so it's going to dissolve a little faster. But in general, 9 to 12 months is a good time frame before you'll need touch up.
Oh, okay, that's longer than I thought. I was thinking like 3 to 6 months or something.
Definitely more than 3, 6 months, maybe if you're dissolving the filler a lot faster than other people for some reason, but I would say in general 9 to 12.
Cool. Okay, that's a little bit less maintenance than I thought. Okay. On microneedling, how many microneedling sessions do you typically need to start seeing results?
Depends on your goals. So for someone with maybe like deeper acne scars, typically they'll need more, like 6 to 8 sessions.
Okay.
But for someone with, fairly good skin that just wants to work on their pigmentation, their skin tone, 4 to 6.
Okay. Do you guys accept Medicaid and take care?
So at Island Skin Solutions, we don't accept health insurance for any of our aesthetic procedures.
Mm-hmm.
But with that being said, if someone has something like acne and they want to start off with a medical appointment, we can start them off on prescription medications and go over sort of like basic skincare and things like that through Dr. Ada's office, Medical Associates of the Pacific. So they would make an appointment there. I could see them there with their insurance.
All right.
But if they were to decide on getting like a peel or lasers, those things are not covered by insurance.
Got it. And so if someone had like kind of like cystic looking acne that they've had kind of like for a long period of time, that's what you mean by that, right?
Any kind of acne can be seen on the medical side of things, and we can start them off there and then introduce our treatments here.
Okay, great. I think that's really important for like especially young adults but even when they get older, they sometimes still have that.
Yeah, so I see a lot of teenagers. I see a lot of teenagers in the clinic side, and then their parents will bring them in to this side sometimes. And definitely women in their 20s, 30s, 40s who have never had acne before, suddenly with hormonal changes might start getting acne, and we can take care of that as well.
Wow, sure. Okay.
Women and men, I should say,
Yes.
not just women.
Okay. How should we schedule an appointment or consultation?
So we have two main ways of scheduling. You can DM us on Instagram or Facebook, and I'm the one that usually responds. You can also call our office, which we share a phone number with Dr. Ada, and her staff helps to facilitate scheduling.
Great. So call Medical Associate of the Pacific.
Correct.
This one is on Botox, and she's asking if you get Botox, will it affect your current acne treatment?
No, you can get Botox while you're using acne treatments.
Okay, cool. What's the best advice you have for younger people regarding skincare?
It's a good one. So my biggest regret is not starting good skincare earlier. I didn't start doing very much of anything until I was about 37 after I had both of my kids. And so I think the biggest thing for young people is wear your sunscreen. You look, when you're younger, when you're a teenager, when you're in your early 20s, your skin is glowing and you're probably doing nothing to it.
Yeah.
It looks really good.
And
then all of a sudden you hit your late 20s, early 30s, and things start going downhill, let's say.
Yeah.
So collagen production decreases, especially around your mid-20s to late 20s, and then every decade it's significantly more reduction of collagen production. And so by wearing your sunscreen, you're not only going to save the collagen that you have, you're also going to prevent sun damage, not just wrinkles and sunspots, but also cancers. I mean, we live here under the sun, and we have to start thinking about preventing skin cancer long term.
Definitely, it's really, really hot outside right now, sunny.
So that would be my best advice. Get yourself a sunscreen that you don't mind putting on every day, and you wear it every day. There's no such thing as I'm not going out in the sun, so I'm not wearing my sunscreen. Just put it on in the morning, no matter what you're doing.
Okay, because that's what I told you. I'm like, okay, I'll wear my sunscreen. And so, what's your favorite product that you carry in your clinic?
So my favorite product is Skin Better's Vitamin C. It's called Alto Advanced. And it's a vitamin C that works not only on external free radicals, but also on internal free radicals.
Okay.
It feels good, it comes in a serum, it is moisturizing, and it works really nice.
I've tried that from you, and I liked it.
Yeah.
Yeah, I need to get some more. I just ran out. Okay, so cool. How do I buy products from you?
So you can buy products by scheduling a free consultation with our esthetician, Sherry. She can go over what she recommends for your specific skin type.
Okay.
So that's one way of doing it. You can also DM me on Instagram or Facebook and set up a meeting time where you can get the products. But coming soon is very exciting. We're going to launch our online product store so that you'll be able to go online, purchase your products, and then just pick it up here at the clinic.
Ooh, that's exciting.
Yes,
and
we're
easy.
excited about that.
What treatments do you have for acne, and how about acne scarring?
We have a lot of treatments for acne. So because I'm a nurse practitioner, I can prescribe certain things. So depending on your acne and your particular situation, there's oral medications that I can prescribe. There's topical medications I can prescribe, and then there's aesthetic treatments. And so I won't get into the prescription side of things because it's going to vary from patient to patient. But in terms of treatments here in clinic, our number one treatment right now, especially for acne clients, is the BioRepeel.
Okay.
That one's going to help with acne scarring, and it has just worked really, really well for us. We also will incorporate products into that, so whether they're prescription products or products that we sell here that are going to complement the treatments really nicely.
Okay, great. What lasers do you have?
So right now we have 3 lasers. We have a laser hair removal machine. It's a diode laser with 4 wavelengths. We won't get into all the details of that, but it works really nicely for hair removal. We have a picosecond laser. The picosecond laser is mostly used for pigmentation and tattoo removal. And that one is really nice because it can be used on all skin types, whereas traditional lasers cannot be used on darker skin types. So the picosecond works well for people with darker skin types with pigmentation.
Okay.
We also, our newest laser is a CO2 laser, and so that's a resurfacing laser.
Cool. Does it hurt?
That's a good question. So the CO2 laser is very spicy.
Okay.
But that being said, the other two lasers are pretty painless, I think I would say.
Like bearable.
Bearable, maybe a little prickly sometimes. And depending on the area we use the laser hair removal on, we can use some numbing cream if needed, but most people do fine with like a little cooling fan.
Okay. Spicy, but worth it, right?
CO2 is spicy, the other two not so spicy.
Okay, but worth it, right?
All
The
are
results.
worth it, yes.
Okay, cool. So I'm new to skincare. Where do I start?
Great question. So we all have to start somewhere. My basic skincare advice for everybody is to start by getting yourself a cleanser that feels nice. And by that, I mean after you cleanse your face, it doesn't feel tight. If it feels tight, it's stripping the oils off your skin. So you want to find a cleanser that makes you feel almost like refreshed and moisturized afterward. So besides the cleanser, vitamin C, a good vitamin C, a good retinol, and like we talked about before, a good SPF. And a good SPF means an SPF you don't mind putting on your face every day.
I want to get rid of wrinkles on my forehead, but I'm scared to get Botox. I don't want it to look fake. Is there any other way to get rid of those wrinkles?
Okay, this is a great question. I get this one a lot. So the answer to, is there another way to get rid of wrinkles on my forehead? The answer is no.
Okay.
There's going to be no other treatment that is going to work the same way Botox works to get rid of a line that has been created by constant muscle use. So you can do lasers, you can do microneedling, and those things can help to reduce the wrinkle, but they're not going to get rid of it. And there's certainly, it's going to take you many months just to reduce it, whereas Botox, you inject it, you're going to see the results in 3 to 7 days. And so there's really nothing comparable to Botox for getting rid of the wrinkles that are made by muscle movements. In terms of looking fake, I also get that concern a lot, especially for first-time Botox users. They think, I don't want people to know I had it. I don't want to look like I can't move my face, like I'm really stiff. And I would say to that, I have not had anyone that has come back and been like, I look stiff, I'm not moving. Everyone that comes back is like, I love it. I got so many compliments about I look refreshed, or I look like I got a good night's sleep. So people will see you afterward and just be like, oh, you know, your skin looks really good, or what are you doing with your skincare? And so it's much more natural and just more of a refreshed look rather than like a fake, like sort of stiff look. Yeah.
But some people don't mind that look either. If that's what you're going for. So what makes you a good candidate for Botox, or not a good candidate?
So the only people that would not be a good candidate for Botox are possibly someone with some kind of neuromuscular disease. So certain medical diagnoses might discourage you from me giving you Botox, even if they wanted it. But in general, Botox is a very safe medication, and we talked about Botox is just a brand name, right? So a neuromodulator is the class of medications that Botox is under. So neuromodulators in general are very safe, and most people are candidates if they have muscle movement that are creating wrinkles that they want to get rid of, or preventative Botox where maybe you don't have wrinkles yet, but you want to prevent that movement before those wrinkles develop.
For sure. So if someone is like pregnant or breastfeeding?
That's a great question. So I do not inject anyone who's pregnant or breastfeeding.
Okay, got it. So they would just have to just wait till after.
Wait until they're done breastfeeding, yeah.
Okay, cool. And is there anything else that you wanted to say, or like say to future clients?
I would say that if you are thinking about getting a treatment, whether it's Botox, lasers, chemical peels, or you're just not sure, Come in, check us out, schedule a free consultation with our esthetician Sherry, who's amazing. She does all of our treatments except the medical treatments. So I'm the one that will do your Botox, your fillers, any kind of mole, skin tag removal, anything medical in nature. I also do everything else. But if you're looking for a free consultation for anything else, Sherry can see you, talk you through the process. I'm also happy to see you. I mostly work on Fridays because I'm in family practice other days of the week. So Sherry's also here more frequently. But both of us are happy to see you for your first time and walk you through the whole process.
Awesome. So that's great. A lot of great information. Yeah, so you heard her come in for a consultation. You guys can also ask me, DM me like questions, put in the comment box questions, but I can only answer so much as to what I know from Shauna and just research, but you know, I highly recommend just coming in, calling them and scheduling a consultation for yourself, because everyone's skin is just different and they, like, you know, it's not one size fit all, right?
Yeah, and everyone has different concerns. You know, what I see and what I would recommend for you might be different than what you're looking for. So we really like to work with our clients to figure out what their goals are and what we can do to help them reach those goals.
Yeah. So give them a call, drop us some comments, and just thank you guys so much for watching. Thank you, Shauna, so much for having us. And yeah, we just want to get, you know, the people in the Marianas like have great skin and healthy. And yeah, just thank you so much for being here.
Yeah, thanks.